You're listening to Puma Podcast.
Hi, I'm Bella Perez Rubio, Puma Podcast, and you're listening to Teka Teka News. Balitang thinking, hindi breaking. In this episode,
We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly.
this week marks 3 years since the World Health Organization declared COVID 19 a pandemic.
Community quarantine is hereby imposed in the entire of Metro Manila. For Manila, ayaw namin gamitin yan, pero kasi takot kayo sabihin lockdown. But it's a lockdown. There is no struggle of power here. Walang away dito, walang gera. It's just a matter of protecting and defending you from COVID-19.
Today, March 15, also marks 3 years since parts of the Philippines were placed under lockdown. What have we learned in that time?
We are in a more stable position. So we think it's timely at this juncture to take stock of what we have gone through in the last 3 years and to learn from the experience so far.
That's Singapore's Deputy Prime Minister, Lawrence Wong.
And we have decided to publish our review in the form of a white paper, and it consolidates the findings from several sources. It covers the review that had been undertaken by the former head of civil service, which focuses on the more longer-term strategic lessons for Singapore.
The white paper he's talking about is an unflinching review of the country's COVID 19 response, something not many other countries have publicly done.
What we have attempted to do in this white paper is to make sense of this breadth of perspectives, taking into consideration all the known facts and data, and try to offer as balanced an account as possible of how we have responded in the last 3 years. We have stated things that we have done well. We have also stated things that we could have done better.
What could Singapore possibly have done wrong? Remember that in those years, they were widely hailed for their organized and high-tech approach to things like contact tracing, mass testing, and social distancing. As such, they had one of the lowest mortality rates in the world due to the virus. But yes, it wasn't a perfect response.
If you think about some of the biggest challenges that we had to go through, clearly the outbreak in the dormitories was one of the biggest challenges we had to overcome. And it could have possibly been a major disaster for us.
Almost half of some 300,000 migrant workers living in Singapore's dormitories had contracted COVID 19 towards the end of 2020.
But fortunately, we were able to manage the situation and keep our dorm workers safe.
Other things the government said it could have done better include scaling up contact tracing and implementing less stringent mask-wearing guidelines. Constantly changing rules, officials noted, frustrated businesses and individuals. Singapore also said it was too slow to tighten its borders when needed, and then too slow to reopen them when it was relatively safe to do so. Sound familiar?
We made our best judgment at that time, but of course, with the benefit of hindsight and what we know today, we probably could have handled certain situations differently. And indeed, today I'm sure there will be a range of different perspectives on what transpired and how certain aspects of the pandemic could have been differently managed.
Deputy Prime Minister Wong noted, however, that these decisions were made amid unprecedented circumstances.
All in all, I would say COVID-19 has been a very complex and wicked problem on a grand scale, with many twists and turns and disruptions and surprises along the way. We had to operate in a fog of war. We had to make decisions amidst conditions of incomplete information. And we had intense debates on what actions to take. And these were often not binary choices, but gradations of options with very difficult trade-offs.
Despite these challenges, Singapore, of course, got many things right and offers other ASEAN countries like us many lessons for the future. More on that when we return.
I would also say overall, when we look at what we have gone through, Singapore has indeed achieved positive outcomes amidst very trying circumstances and challenges. We have one of the lowest COVID death rates in the world. We have safeguarded livelihoods, kept supply chains open, and supported the vulnerable. And importantly, we have emerged from this crisis more united as a nation than before. And we are one of the very few countries in the world that has done so.
Again, that's Singapore's Deputy Prime Minister, Lawrence Wong. The government said it extended financial, social, and mental support to those in need. Another important win is that they were able to quickly adjust to home based learning, averting the severe learning disruptions seen in other countries. And then, of course, they were one of the fastest to vaccinate the majority of their population. Granted, Singapore has a tiny population, just under 6 million. But the point is, they were also quick to organize and procure vaccines and other supplies like masks and medicines for their people.
I would say, it's very hard to distill such a complex crisis into one or two things. But if you look overall at the experience, vaccinations was clearly such an important way out of this pandemic for the world and for Singapore. And overall, our whole vaccine strategy, from procurement to the rolling out of the vaccines to the communication to actually delivering jabs to people, I think we have generally done well, and that has enabled us to get through this pandemic. It's a major, very important strategy.
3 years into the pandemic, and Singapore is an outlier in its attempt to thoroughly review its COVID 19 response.
There will certainly be a lot of wish that things could have been better with all the benefit of hindsight, but we proceeded with the best judgment we could at that point in time. And the purpose of this review is not so much to pass judgment, but to learn and to ask ourselves from all these experiences, how can we be better prepared when the next pandemic comes? Because we know it will definitely strike Singapore in a matter of time.
Attempts to review pandemic responses have been a lot more contentious in other parts of the world. Last year, an economics professor at Johns Hopkins University and 2 other European economists published a paper that sparked heated debate in the US. The paper, which has not yet been peer-reviewed, claimed that lockdowns were largely ineffective at preventing COVID 19 deaths. Epidemiologists, however, have called out the methodology used and the evidence provided. They also noted that the analysis was conducted by economists rather than medical professionals. Meanwhile, back in Singapore, the white paper is set to be taken up by the country's legislature.
We will publish the white paper, we will continue to take feedback and views, and we will have a full debate on the white paper in Parliament later this month so that we can distill the important lessons for Singapore.
Because, as Deputy Prime Minister Wong pointed out, this likely isn't the last pandemic we'll live through. Remember, the coronavirus is still out there.
We are better prepared, but we are never complacent, and we know that the next pandemic will be different from what we have gone through, just as COVID has been different from SARS. So while the lessons will help give us a better sense of preparedness, we must never fight the last war. We must not allow the lessons to become hard-coded into a certain doctrine that might lead us down the wrong path, especially if the next virus turns out to be very different in character and nature from what we have experienced so far.
And that was today's episode of Teka Teka News. Again, I'm Bella Perez Rubio. This episode was edited by Pidoy Blanco. If you like this episode, share it with a friend or two. And don't forget to follow Teka Teka News and Puma Podcast wherever you get your podcasts. At para sa mga mahilig manood sa YouTube, Puma Podcast na rin po kami doon. Just search Puma Podcast and subscribe to our channel. Thanks for listening.